It's a local edition Tuesday. My name is Mitchell Chase. With me right now from Antelope Valley Hospital, we have Dr. Jatinder Pruthi. It's great to have you, Doctor.
Good to see you.
Welcome. Specializing in the stomach, gastrointestinal. That's
Yes.
exciting stuff. When's the last time you did an endoscopy? Just curious. This morning?
This morning, yesterday, we do a lot of endoscopy.
Just checking. I've had a bunch of them, so they're kind of fun, actually. It's no big deal. But let's talk about, you have a seminar coming up. It'll be on the 24th, Thursday. That's coming up Thursday the 24th. And it'll be at 6:30, Antelope Valley Hospital Outpatient Imaging is where that's going to take place.
We're going to talk about the gastroesophageal reflux disease. So what that means is gastro means stomach, esophagus means esophageal. So the acid from the stomach refluxes or backs up, returns into the esophagus. That's not supposed to happen. So when it happens, then you feel the heartburn and the burning sensation. This disease process is called gastroesophageal reflux disease, or the heartburn in common terminology. So as the acid backs up, it can erode the lining of the esophagus and can cause ulcerations, and then later on can cause strictures and the bleeding, and the lining can slowly change into Barrett's esophagus lining. That is a name given to the new changed lining, which has some potential for turning into esophageal cancer. So as we were talking about whether can the reflux disease kill you? Well, in the long run, if you develop esophageal cancer, that can cause death. And we know that the esophageal cancer rate has been going up slowly. And that is related to Barrett's esophagus and reflux disease.
Okay. At what point should somebody say, like, if you're getting heartburn once or twice a month, is that something to be concerned about?
Well, if you look at the data, about 60 million Americans get heartburn once a month at least. About 25 million get every day. So now we label a patient with the reflux disease if you have at least heartburn twice a week. So that means the acid is backing up more frequently than it should, and then you need to seek medical attention. People can try over-the-counter reflux medications to suppress the acid, but after 2-3 weeks, if the symptoms continue, you got to see the physician.
Okay, so if you're taking over-the-counter medication like Prilosec, OTC, if you're taking something of that nature, if all of a sudden after 3 weeks you're still taking it, you should go see a doctor.
You should go see a doctor, because we want to make sure that it's not damaging the lining of the esophagus and you're not developing any complication. If there is, then we can either adjust the dose of the medications or suggest something else.
Years ago, I don't know if it's still being done, but there was a procedure called the Nissen fundoplication,
Yes.
where they rebuilt the valve connecting the stomach to the esophagus. Is that still being done?
Yes, let me explain it to you in a little simple terminology. See, normally at the junction of the esophagus and stomach, there is supposed to be a sphincter that is called as lower esophageal sphincter. Now, this sphincter remains closed and prevents the acid from backing up. So when we eat food, the sphincter relaxes, the food goes down, and then it closes down, and then periodically relaxes to let the air out. Now, in reflux disease patients, the sphincter is weak, so the acid backs up. Now, we can correct this sphincter surgically. That is the Nissen fundoplication, where they wrap the stomach around the lower esophagus to make the junction tighter.
And is that done with laser now, or?
Laparoscopically. They can do it laparoscopically. But the patients who, everybody is not a good candidate for Nissen fundoplication surgery. Patients who are young and healthy have, long life ahead of them, and they are hooked on these medications. They cannot do without the reflux medications. So those are the people who are good candidates for reflux.
Do you
surgery.
suggest at times like putting phone books on the bed, elevating the bed, or anything like that?
There are certain lifestyle modifications that we can do. Dietary recommendations like avoid coffee.
That's bad.
Soda, peppermint. and the fatty and fried foods. So these are the foods which decrease or lower the sphincter pressure. So the pressure goes down, sphincter opens up, and the acid backs up. And the other things that you can do is take care of the acid. We can take help from the gravity. So raise the head under the bed by 6 inches, and the acid at nighttime stays down. But these are some things that practically a lot of people cannot stick to them. So many things: quit smoking, alcohol, coffee, soda, fatty and fried foods, lifestyle modifications, and do not eat anything before 2 to 3 hours before you go to bed, because when your stomach is full and you're lying down, so there's more acid backs up.
All right, now you're going to have the lecture. It's a free lecture. It's coming up on the 24th, Thursday the 24th, Antelope Valley Hospital outpatient imaging. 6:30 is when that's going to take place. There it is, right on the screen for you. And will there be an opportunity for people to ask you questions?
Of course, we make it as informal as possible. People can interrupt me anytime and ask the questions. The whole idea is to get them involved, let them know about this disease process, so answer their questions, answer their concerns, educate them about the treatment process and the complication, the risk, and the screening and everything else.
Now, I don't know if you have any scientific evidence for this or not, but as we close, I wanted to ask you this question. With the economy being the way it is, a difficult time, have you noticed an increase in people with stomach distress?
Well, stress can do a number on you. The stress can increase the acid production in the stomach and cause ulcerations. And as the acid production goes up, so does the reflux. So I don't know whether there is any data or the numbers, as you said. I can't quote those numbers. But looks like it's possible. And particularly in the financial stress times, you get the heartburn.
When you come in, you're always very calming. You're a nice man. Dr. Pruthi, gosh, you've been coming in for years now.
Yes.
It's real good.
It's good to be here. It was nice talking to you.
Thank you very much. If you want to know about reflux, it comes up Thursday, the 24th. Antelope Valley Outpatient Imaging is where that can happen. B-17 is going to fly into town. We got to go right now, but coming up next, wait till you hear this story. You don't want to miss it.